Thank you for staying with us. Now, the Ministry of Health on Tuesday has announced that 132 people have tested positive for COVID-19 out of a sample size of 1,187 tested in the past 24 hours, marking a positivity rate of 11.1%. This brings to 340,600 total confirmed positive cases out of 3,931,599 cumulative tests conducted so far. In a statement sent to newsrooms, Health CS Susan Nakumicha noted that 119 patients recovered from the disease, pushing the total recoveries to 333,993, and that no deaths were recorded within the said period. In the last 24 hours, the ministry recorded 20,643 vaccines had been administered, while the total number of people fully vaccinated in the same period was 5,127. We are now joined by Lillyan Mutua from the Nairobi County, who is the head of health promotion, to discuss all matters to do with COVID-19 and a cholera outbreak. Thank you so much, Lillyan, for joining us. Now, we've seen that the country has recorded 132 new COVID-19 cases, and the positivity rate has shot to 11.1%. Should Kenyans be alarmed of this?
We know that we had gone low on the cases that are being tested positive. So once we see the number of testing for positive cases going up, we are aware that we are into another wave. I can attest that within the last 3 weeks, a lot of community conversations were going on where people were saying that they're having a cold. And the cold was not the normal cold. Some were feeling feverish. Others were not able to cope with their daily work. And for sure, that shows that there's a community transmission ongoing. Mm-hmm. Yes.
Now, is it time that Kenyans go back to wearing their masks and social distancing, or can we attribute the increase in numbers to the removal of these restrictions?
Well, from the previous past, since we started having COVID-19 in our country, we have seen that there are times that the cases go high, and there's a time that we have very few reported cases, and in some instances, we even have days that we have 0 reports for people who have tested positive. Yes, the guidelines and the protocols for prevention and for the COVID-19 were not really put off, but were eased. Where we found that we could still go back to communing together, where we could mix up in the social spaces. If you look at our transport, now we are carrying full capacity. The religious institutions were opened, schools were opened, and life was brought to near normalcy. What we should be aware of is once the numbers start increasing, it is ourselves, we the citizens, to remember what we went through, especially in 2020, and just take the precautions again. So not only for COVID, but when we were putting on the masks, we also saw that the respiratory infections went down. We saw that acute respiratory infections, like the pneumonias, were also down. The allergies were also down, accompanied by the hand hygiene. Diarrheal cases also went down. So we should just look at the gains that we have had since 2020 to date and not revert to where we were. So if the incidences start going up, even if we are not able to really maintain the 1.5 meters social distance, can we surely mask up? If you look at the public transport, you find that people are overcrowded in vehicles and no masking. If you go to places like supermarkets, very few people are masking up. If you go to the workplaces, very few people are doing the same. I really appreciate some of the religious institutions who still adhere to the COVID-19 regulations, mostly the masking up and the hand hygiene. As much as their churches are back to full capacity, but some of the religious institutions, people are still putting on their masks. So when we see the increase of cases that are being tested and they're positive, let us just adhere to the same measures like previous.
You've mentioned that there are community talks, that there's a flu that's going around. What are some of the symptoms that Kenyans should be on the lookout for in this seventh wave of the COVID-19? Should we expect that things are going to go back to how bad it was in 2020 if restrictions are not upheld?
Let us appreciate, number one, that the COVID-19 has no cure. It's a viral disease, so there's no cure. But let us also appreciate the gains that we have made because of the vaccination. We know even today, to this day, today, we have still some people who have gone to the ICU or the high dependency units in different hospitals. And once history is taken, we find that these people, most of them, the big number of them who are landing in the intensive care are people who have not been vaccinated. So let us also appreciate the benefits and the importance of being vaccinated. When we look at Nairobi, we know that we are doing at 54% plus of people who are fully vaccinated within the total population that we had targeted for vaccination. So we are yet to do 40 plus of people to get vaccinated. When we look at the 54%, it is those who have completed. At least they have had their second doses, and some even having their booster doses. But we still have those who are yet to complete their second because they started way later, and there are those who are still unvaccinated. So when we look at the ease in the community in Nairobi, that is one of them. We know that some other counties are not doing very well, but it is our own responsibility. And I've said, when we look at where we were in 2020, with the lockdowns, with the staying at home measures, with the socio-economic impacts that were not very good for us as a country, people not going to work, the children not going to school, let us learn from our previous experiences and embrace the guidelines and the measures that the government are putting for us. So let us appreciate that all of us who are eligible for vaccination, that is all adults above 18 years, should get the vaccination, should complete their schedule as appropriate, according to the type of vaccine that they're getting, and also getting the children who are 17 and below getting vaccinated. We know that we are towards the end of the year. We have seen what is going on. There are children who are transiting from the primary to their junior high school. We have those who are joining the high school. We shall also have candidates who sit for their O levels, and soon they'll be going to colleges. And we know children will travel far and wide. Let us ask as parents, as guardians and caregivers, what does it take if our child got infected when they're away from home? So during this long holiday, can we also ensure that the children who are supposed to get the vaccine also get the vaccine? We also have very clear guidelines that people who have chronic illnesses, people who have issues with their immunity, for example, people who are living positively with HIV/AIDS, even if it is the patients who are having TB and hypertension, any non-communicable disease like diabetes, we know their immunity is already tampered with because of the diseases that they're already having, some of them being chronic. We know they can also benefit from this vaccine, and it does not interfere with the medication that they are being given, as well as the pregnant mothers and the mothers who are breastfeeding. We have seen that the mothers who have been pregnant and gotten COVID vaccine, even if they get the COVID vaccine, it is not very serious disease. So let us also appreciate the information that once you get the COVID vaccine, it protects you from severe diseases or that can occur because of the COVID-19. That is the complications. And also the complications at times may lead to resort to death. But we have seen that once you get the vaccine, you're able to, even if you get the COVID disease, your body is able to fight for you. Yes.
Now, the people already exhibiting symptoms of the flu, is there anything that can differentiate the flu-like symptoms and COVID-19 symptoms? Those people already exhibiting the symptoms, what precautions should they take perhaps stay at home, put on their masks? What precautions should they take?
It's very good if we know that maybe a lot of people, because in 2020 we were doing mass testing. Right now we don't do mass testing, we do targeted testing, where if you feel like you are exhibiting the signs and symptoms of COVID-19, you could go to the nearest health facility, diagnosis will be made, you will be tested, and if we find that you have the COVID-19, we are also able to trace the contacts who have been around you, maybe your family, your workplace, get a better history about the socialization and see who maybe was exposed and ask them to also self-isolate. Right now, people are not being isolated in health facilities. We are asking people to self-isolate at home. We know some of them, as we follow on contact tracing, we find that they do not follow that, but we ask, even if you're self-isolating, or if you exhibit the symptoms, even if you're not going to go to a facility, kindly try and have your mask on. Also, appreciate hand hygiene by washing your hands under running water with soap. Also, try to keep social distance. And if you think the symptoms that you are having are becoming a bit too severe, kindly visit the nearest health facility. The other thing that we have seen being exhibited by our citizens is that if, like now when we are saying that there is the cold, if you go to most of the pharmacies or chemists, they'll tell you people are coming with self-prescriptions of what people were being treated with when we had COVID at a large scale. So we are also requesting people not to self-medicate, because overuse or abuse or misuse of antibiotics, in the long run, you'll find that you are not able to get cured by the same when you need the same drug. So self-medication without prescription is also not warranted. And we are also re-emphasizing this for the young children. If you have a young child, kindly take them to the nearest health facility. Let them have a prescription for the appropriate diagnosis that will be made. Yes.
Now, we're seeing that the country is experiencing some rains in different parts of the country. With this, we've also seen that there's an outbreak of cholera in various counties. What can you say about that?
We know that from September, there have been episodes of cholera, and not as much as it used to be before. And we can say that through the Ministry of Health and the county governments, the disease surveillance personnel are on the ground, looking at whether we have any suspected cases and taking the samples for testing. And we have seen that some people have resorted to be positive. And the same like we have done for cholera and for polio before. We still follow up the chain of the contacts who have been with them, looking at maybe where they may have eaten or consumed or even drank anything that may have been contaminated. So when we look at cholera, we usually say once we have one case reported, it is termed as an outbreak, because cholera is a notifiable disease according to Ministry of Health and the World Health Organization standards. So if one case happens, we are on a quick alert to follow up and see what might have triggered it. Do we have any issues on hygiene? Do we have any issues on sanitation? When we are looking at cholera prevention, we still re-emphasize on the hand hygiene. People should really wash their hands at the critical time, and the critical time include when you visited the washroom, before you eat, before you prepare your food, if you're going to breastfeed, if you're going to change your baby's diaper, and also looking at sanitation, environment sanitation. We also emphasize on food safety, the do's and the don'ts when preparing food to the time the people are taking it. So when there's such an alert, you look at the food hygiene practices. So if it is foods that are supposed to be eaten raw, you're supposed to wash them thoroughly, make sure that you contain them in very safe measures, that they are not going to be contaminated. We also look at the storage. If you're going to store any foods that are cooked, before you reuse them again, they should be thoroughly boiled. We also look at how you're going to treat your water before you take it. We know during the rainy seasons, at times, the clean water could be contaminated with the rainy, stormy water. So we also emphasize on when you are drinking water, is it safe for use? So we request that the public is able to get the aquatab and the water guard, which you can use for treating your water at home, just to make it safe. Then we also say the storage of the water, very important. Keep your water covered. The treatment for aquatab and for water guard, once you've treated your water, it should stay for 30 minutes before use. And the water should also be very well mixed. If you're having children in the house, also teach them that they do not touch the water where it is kept. And if they should maybe put it in maybe whatever vessel they are using to drink, they also do not contaminate the main water reservoir. We're also looking at environmental hygiene. How do we dispose the waste or the garbage that we have from maybe our household, our workplaces, and other places? Let us not just scatter it around, because if there's any cholera that is happening and the flies are going to go to that garbage or they will go to that waste, then land back on your food or your drink, it will be a source of contamination. Also, the way we dispose the human waste, very important. Let us use our toilets very well. If we are not able to, let us also talk to the public health officers and see the appropriate ways. We can have some pit latrines dug. We can also have safe human waste disposal. The other issue is when we look at food handling. Let us make sure wherever we are eating, at the eateries, at the hotels, the food handlers are certified. They have the medical certification where they have been cleared with a clean bill of health. Let us also look at where are we eating. For instance, in Nairobi, we find that a lot of people who have been infected by the cholera disease are male between 21 to 35 years. These are people who are rarely at the household and maybe eating out, and also 51 to 60, still the same habits. We know the children are also going for their long recess. Let us also give this information to the children that before they eat, they should wash their hands. Before they take any food in the home, it should be heated, and also the safety of the water that they drink, so that if they have to go for a distance, they also carry their own water and not just take any water anywhere. So these are measures that are being taken, and for Nairobi, we are working very closely with other collaborators like the Nairobi Water and Sewerage Company. We are also bringing other people on board, like the environment sector. So everybody is on that alert as a county in Nairobi. We are also having our implementing partners on board and other facilitators. So it is a multi-agency when we are responding to cholera. Yes.
Now, Lillyan, if you could just share your final remarks, even as we wind up this interview. Kenyans, we are almost reaching the December holidays. In regards to COVID-19, I know people will be traveling up country, others will be coming from up country, coming to Nairobi. What precautions should Kenyans take even as we go to the holidays?
We will say that let us take all the measures that it takes, first of all, to protect ourselves from COVID-19, the same measures for cholera. Let us see that when we are traveling, we carry our own foods, our own drinking water, our own drinks. If we need to maybe take any other, maybe the tea and whatever else that we need, let us have it carried by us, what we have prepared. Let us also refrain from eating along the roads or the routes that we travel. Let us also make sure, like now when we're having the rain, let us make sure that the water that we take, even at household, is very safe. Let us also say that any person who suspects to be having COVID or cholera, or even now that our neighboring country, Uganda, has Ebola, if you have any of those signs and symptoms, kindly you can call 719. That is a national MOH hotline number. You can also talk to them and tell them what you're experiencing. They will be appropriately be able to link you to the nearest facility and also follow-up being done. If you're within Nairobi, use 1508. That is our emergency operation number for Nairobi County, not only for health, but for any other disaster or emergency that happens, even if it is not health related. because we are able to link you up to the other agencies. Let us just take care of ourselves. Let us take the appropriate measures, because if the episodes of COVID-19 again go very high, or we are also reporting very high episodes of cholera, then it means now we move to the curative side, which also takes a lot of money. And lastly, just to remind the listeners and people who are watching, if you have any signs and symptoms of cholera, we should know what cholera is, because people also mistake diarrheal diseases for cholera. When one has cholera, it is very loose stool, which you cannot hold, which you cannot even say, I'm going to go to the washroom. It just passes. You cannot be able to hold it. The color is white, like the rice water, and it is effortless. And let us also know that cholera is a viral disease. It has no cure. The best cure for cholera is immediately it starts, and even for any other diarrheal disease, take plenty of water. Because once you lose a lot of water, that is where the complications start, and that is how we end up losing lives. So if you have cholera or diarrheal diseases, the treatment is water, water, water. Take plenty of water. And also when you're having diarrhea, illnesses or cholera, make sure you take some ORS, which is mixed with the water, and also take some zinc tablets. This helps to supplement the nutrients that you are losing, and you will not be able to be very fine. So anytime you think you're having cholera, if you've seen that watery, effortless, white-looking diarrhea, kindly call 719. If you're in Nairobi, call 1508. Thank you.
Thank you so much, Lillyan. That has been Lillyan Mutua from Nairobi County, the head of health promotion. Now,